Welcome to Chapter 17, entitled Pharmaceutical Care in Asia. The implementation of pharmaceutical care services has been variable across in Asia. In part this reflects the large disparities that exist within and between countries, including non-in-countries separation of prescribing and dispensing such as China, Malaysia, and Thailand. Nevertheless, there are increasing reports of innovative services being delivered in hospitals and community pharmacies. Innovation in the development and implementation of community pharmacy services has occurred, despite the lack of separation of prescribing and dispensing in countries like Malaysia. Barriers to further implementation include the uneven distribution of pharmacies as well as intrinsic and extrinsic barriers such as negative perceptions from other healthcare professionals and limited confidence among pharmacists to provide new services. However, the widespread investment in new models of education and practice is expected to result the pharmacy profession move forward in the coming years. Let's begin with an introduction. Asia is the largest and most populous continent, with more than 4.4 billion people living in both densely and sparsely populated regions. Asia's population is living longer, has increasing rates of multi-morbidity, and has greater need for and access to medicines. This demographic shift has changed the need for healthcare. One of the key changes has been in the provision of medicines and pharmaceutical care, which has evolved considerably over the last decades. Greater access to medicines and pharmaceutical care has been instrumental in improving therapeutic outcomes, disease management, patient safety, and quality of life. This has had corresponding implications for pharmaceutical policy and healthcare expenditure. Next we will discuss the concept of pharmaceutical care in Asia. In Chapter 1, Van Mill describes how the definition and implementation of pharmaceutical care varies according to the location of practice, legal framework, political context, and healthcare system. This is particularly true in Asia where there is great diversity within and between countries. This lack of uniformity means it is very challenging to summarize pharmaceutical care across Asia. For example, in Asian countries such as China, Hong Kong, Thailand, and Malaysia, physicians both prescribe and dispense medicines. This practice is at odds with the practices advocated by organizations such as the Pharmaceutical Society of Australia that maintain that separation of prescribing and dispensing provides flexibility and choice for patients while providing safety through quality assurance and risk management. This is the case in many countries with a shortage of pharmacists, where medicines are often sold with or without a prescription through private drugstores that are not necessarily staffed by registered pharmacists. At the other end of the spectrum, tertiary hospitals in many Asian countries provide advanced clinical pharmacy services that are of the highest international standards. Given the diversity of pharmaceutical care across Asia, we provide a snapshot rather than a comprehensive examination of pharmaceutical care across the continent. We provide a narrative review of published peer-reviewed literature rather than an overview of pharmaceutical care based on national policies and regulatory frameworks. This peer-reviewed literature was identified through searching major bibliographic databases, including PubMed, Embase, and Cochrane Library. Next we will discuss pharmaceutical care in East Asia. Pharmacy in China was predominantly focused on the areas of pharmaceutical sciences until the early 2000s. Early development of pharmaceutical care focused on implementation of medication management services to address the issues of medicine-related problems and to ensure rational medicine use. Development has become more rapid and geographically widespread over the past decade. This has been described as being aided by Chinese healthcare reforms and the corresponding introduction of more clinical roles for hospital pharmacists. In a 3-month intervention study, a clinical pharmacy services in an intensive care unit resulted in positive effects on patient outcomes and reduced medication errors. Hospital pharmacists have also taken on new roles in antibiotic stewardship and now offer guidance on antimicrobial use to physicians. However, pharmacy practice in most community pharmacies remains centered on the traditional roles of medication dispensing and counseling. Community pharmacists have reported barriers to the wider implementation of pharmaceutical care in China include the lack of time, skills, information, and financial incentives. Nevertheless, it is expected that services offered in hospitals will be expanded and offered in community pharmacies in the future. In fact, community pharmacists have expressed that they were optimistic about providing pharmaceutical care services on traditional Chinese medicine, which is widely used by the population. In South Korea and Japan, pharmaceutical care services have been expanding and include services such as therapeutic drug monitoring, anticoagulation services, and medication management. For example, pharmacists in Japan are now involved in providing clinics for anticoagulation, cancer chemotherapy, and asthma. These clinic-based services began as a pilot program in 2000 and have subsequently expanded nationwide. These clinic-based services are now covered by the universal health coverage in Japan. Barriers that have been reported to wider implementation of pharmacy services include the lack of remuneration, a shortage of pharmacists, and pharmacists lacking the therapeutic knowledge and clinical problem-solving skills necessary to implement the range of new services. Next we will discuss pharmaceutical care in the Eastern Mediterranean region. Countries in the Eastern Mediterranean region have faced similar issues related to the introduction of pharmaceutical care. Provision of pharmaceutical care in Jordan has primarily been delivered through government and non-government hospitals, where there is an increasing number of studies evaluating the impact of a clinical pharmacy services. This has been reflected in the introduction of pharmaceutical care courses in Jordanian universities. Kuwait too is experiencing positive developments in this field, with a push for recent generations of pharmacists to trial new services in hospitals. A recent study by Al-Hakan reported that while most pharmacists report they provide medication counseling to their patients, the public and physicians perceive the professional role pharmacists is limited to providing specialist diabetes-related pharmacy services, e.g., glucose monitoring and healthy lifestyle counseling. Like other countries within the region, Lebanon has introduced clinically orientated pharmacy education. This will provide the basis for the introduction of new community pharmacy services, which up until now have remained mostly centered on compounding and medication dispensing. Pharmacy practice is also developing in other Eastern Mediterranean countries. Like in most other countries across the world, implementation of these new services has been inconsistent. For example, implementation of formal pharmaceutical care services in the United Arab Emirates has mainly been limited to the government settings to date. In Iraq, community pharmacies have begun to provide medication counseling and monitoring of body weight, blood pressure and blood glucose screening, although this has reportedly been met with resistance from some physicians. More widespread implementation in the community sector has been limited due to lack of remuneration, workload, and a shortage of qualified staff. It has been reported that pharmacy students and community pharmacists have a good understanding of pharmaceutical care in Saudi Arabia. However, like in other countries, most clinical pharmacy services are concentrated in hospitals. These services include discharge medication counseling and monitoring of medication therapy to reduce the risk of any adverse drug reactions. Pharmacist-led mediation adherence clinics are conducted for patients taking anticoagulants. In these clinics, the pharmacists are permitted to adjust medication dosages and switch anticoagulant medications. The breadth of services offered by pharmacists is expected to expand due to the increasing number of graduates from the Doctor of Pharmacy programs. Indeed, there are now efforts to expand postgraduate residency training programs in Saudi Arabia that will increase the capacity of the pharmacy workforce to deliver new clinical services, even if not all the graduates have specialty training in particular therapeutic areas. Qatar is similarly experiencing an evolutionary phase, due to an expansion of health service, educational initiatives as well as leadership at national and practice levels. For example, most hospitals under the umbrella of Hamad Medical Corporation, abbreviated as HMC, have reportedly offered clinical pharmacy services such as medication therapy management for more than a decade. There are examples of pharmacy programs in Qatar and now offering Doctor of Pharmacy programs, hospital-based training, and ASHP-accredited postgraduate programs. And now we will discuss pharmaceutical care in South Asia. India has a very large network of pharmacy schools and a large pharmaceutical industry. Drugstores are widespread across India and they are often the first point of contact that patients have with the health system. Most drugstores remain focused on medicine distribution. Nevertheless, there are reports of initiatives that utilize the country's network of drugstores to identify and refer patients with symptoms suggestive of tuberculosis to public sector clinics for diagnosis and treatment. Medication therapy is usually managed by physicians with help from nurses. Given the large pharmacy workforce in India, it could be argued that the expertise of the pharmacist is underutilized. However, many hospitals in India have implemented clinically oriented roles for hospital pharmacists, and this has been associated with improved patient health outcomes. Pharmacists in these hospitals have started to provide drug information, participate in ward rounds and monitor patients for adverse reactions. Pharmacy practice in Pakistan and Nepal has been focused on the pharmaceutical industry. However, pharmacists have begun to work in hospitals and community pharmacies with greater focus being given to patient counseling and health promotion. Next we will discuss pharmaceutical care in Southeast Asia. There is great variability in the understanding and implementation of pharmaceutical care in Southeast Asia. This partially reflects differences in pharmaceutical policies and health systems in each individual country. For example, for historical reasons the structure of the health system in Malaysia and Singapore more closely resembles the British model of healthcare, whereas the health system in Indonesia more closely resembles the Dutch model. These differences are reflected in the pharmaceutical care roles performed by pharmacists. In Malaysia, the pharmaceutical services have developed from being solely focused on supply to being focused on the quality use of medications. Many hospital and community pharmacies in Malaysia now provide chronic disease management, medication reviews, smoking cessation services, and weight management programs. Other specialized services provided by pharmacists in hospitals include anticoagulant treatment clinics, therapeutic drug monitoring, and antimicrobial stewardship. Thailand has made significant advances in implementation of clinical pharmacy education and practice over the past decade. Hospital pharmacists in Thailand are now involved in conducting medication management outpatient clinics. Thai pharmacists also perform medication reconciliation, patient education and manage medication-related problems. Community pharmacists in Thailand have also begun to provide innovative services such as health assessment, health promotion, and medication usage reviews. In Cambodia, specific private pharmacies have worked with the National Tuberculosis Program since 2005 to refer tuberculosis symptomatic patients to public sector TB clinics for diagnosis and treatment. Clinical pharmacy and pharmaceutical care is relatively new in Indonesia and, therefore, awareness and acceptance by healthcare workers remains inconsistent. Several hospitals now employ pharmacists to deliver clinical services on the ward, monitor medication treatment and provide counseling. Indonesia is a populous and geographically diverse country, and so it is likely that it will take years before the full spectrum of clinical pharmacy services is implemented. This situation in the Philippines is similar to that in Indonesia, where implementation of pharmaceutical care has an opportunity to expand. Many countries in Asia experience common barriers toward the provision of pharmaceutical care, including the lack of awareness and support from physicians and other healthcare professionals. Thank you.